Hey guys, so today we will be doing our patient assessment and we'll be using my little friend Travis. So we are gonna start, well, when we have the information further, we're gonna have like a 35-year-old male complaining of chest pain. So in the beginning of your patient assessment, we're gonna start with scene size up. So scene safe, BSI. We're going to have the mechanism of injury or the nature of illness. In this case is chest pain and its nature of illness. Number of patients, 1. Additional help or resources, keep it in mind, not sure. And we're going to suspect a C-spine. All right, so into the primary assessment we go, the ABCs, airway, breathing, circulation. Airway, hello, sir. I'm Brianna Szydel coming from LTC, blah, blah, blah. We're going to go on and explain where you're from, kind of deal. And so we're going to imagine that he's talking back. Oh, yeah. Okay, so it's patent. The airway's patent. And if it were to be a lower airway or air deal, we can also apply that oxygen. They're breathing. We're going to check if it's normal and equal, and we can listen to lung sounds. And we're going to want to go to the mid-axillary on the sides here. And their circulation, we're going to want to see if there's any bleeding. Going to look at the skin condition, which it seems to be cool, pale, and clammy. Their pulse seems to be regular, and their heart rate seems to be increased. So, pulling up with our GMCs, we're going to want to look at the general impression. So, once again, we have that 35-year-old male in chest pain. And, sir, when did you see this chest pain? Oh, 20 minutes ago? Okay. So, do you know where you are today? Yeah, you're at your house? Do you know your name is? Travis? Okay. Do you know what the date is today? Yep, it is Wednesday the 8th. Awesome. Okay, so obviously we're going to want to check their AFPU scale, which is like awake, verbal stimulation, painful stimulation, or unresponsive. So our patient today is alert. And awake. He was answering to my questions, and he is well aware of the situation. And today, what'd you call us up for today, sir? Oh, you noticed chest pain when you were moving stuff around the house? Okay. So let me just press on the chest and palpate it to see if it worsens. Oh, it worsens? Well, it doesn't worsen in a true cardiac situation. The only time chest pain would worsen when I would press on it would be in an MI angina or a cardiac patients. There would just be no problem with the chest kind of deal. So jumping into the patient history, you're going to want to do OP-QRS-T and sample. So, and you also want to get those vitals. So blood sugar, SpO2, pulse. You want to look at that skin again, blood pressure. Then you want to look at AVPU, their pupils, whether their pupils equal and restrict light, whether we need EtCO2, and we're going to also want to check that temperature. So in OP-QRS-T, the onset is the fact that, what were you doing when you realized the pain? Oh, yep, moving those boxes. All right. So in provocation, what if you lift your right or left arm? Does it worsen the pain, or does it go away? It doesn't worsen. It doesn't go away. It's still there. Okay. So the quality. Can you describe your pain to me? Okay. So it's like a crushing. Okay. So how would you rate your pain? On a scale of 1 to 10, 10 being the worst. How is it right now? An 8? How was it about the 20 minutes ago when you realized it? 10? Okay. So, how did you, signs and symptoms of this in our sample is that he has chest pain. Sir, do you have any allergies today? No? Okay. Are you on any medications? No? Past medical history of this? Hypertension and heart condition, all right. Do you go to the doctor frequently for that? You're not on any medications, or do you just not take them? You go, okay. When was your last oral intake? About 5 hours ago, okay. What was your event leading up to this once again? Moving those boxes around the house, okay. So going back into our second patient assessment, into our main one, we're going to want to do a physical body exam. So we're going to want to palpate the chest, and check that C-spine, feel the head, neck, look around, check that pelvis. He seems to be pretty normal, and you're going to want to manage any secondary injuries. You also want to check those vitals once again. And once again, those eyes are, pupils are equal and restricting the light. And in order to treat this patient, we have suspected that this patient has an MI due to the worsening pain of the chest palpating. As EMTs, we are allowed to give 2 to 4 tablets orally of aspirin, 2 tablets of being 162 milligrams, 4 tablets of being 324 milligrams. In this case, I would give 4 tablets at 324 milligrams. We also can give nitroglycerin at 0.4 grams. We can do oral paste, spray, and we also are going to want to give that oxygen with a non-rebreather mask at the flow of 15 liters per minute. And when we are giving these medications, we're going to want to make sure we have the right route, right dose, right medication, right time, right patient, and we're going to want to make sure to document this. And once we're done, we're going to want to transport as soon as possible and call that ALS for an intercept, just in case if it was prolonged. And that is our patient assessment with Travis today. He is now living, and he is strong and better than ever. Thanks, guys. Bye.